let me ask you, what really makes a good doctor? If you're not happy, how are you supposed to help your patients?
What's up guys, Dr. J here, osteopathic physician. In this video we're going to be talking about the drug Minoxidil, also known as ROGAINE. We're going to be talking about side effects, mechanism, little history, and at the end of the video, if you watch toward the end, you're going to learn how I use the medication myself, how I recommend that you use it, as part of my 4-step treatment to cure your hair loss and regrow hair. Alright, without further ado, let's get right into it. Minoxidil. Super interesting history, and I feel like it's important for you guys to know how it was actually discovered. And it was actually still is used as a blood pressure medication, but was originally studied as a blood pressure medication. During those clinical trials where patients were taking it orally to control their hypertension, coincidentally, they were getting hairier. They were growing beards, their hair was getting thicker as a random side effect of that blood pressure medication, and ended up being studied for hair loss and later FDA approved as one of the first medications for hair loss, but a super interesting backstory. Now, taken orally, you regrow hair everywhere. However, that's obviously not the goal for your hair loss. You don't want to get a hairy face and back taking this medication. So we don't take it orally anymore for hair loss. But with that being said, we know how it works for blood pressure. So it binds to the smooth muscle cells, dilates them, and your blood pressure drops. Now, for hair loss, we're less certain about how it actually works. We do know it has something to do with binding to those potassium channels. But in terms of regrowing hair, we don't have the exact mechanism. So it's a very interesting medication, but we do know that it works. It works by increasing the volume of the hair follicle and the number of hair follicles. So it actually stimulates new hair follicle growth and increases the size and vitality of existing hair follicles. So, Minoxidil. Obviously, we don't want to take it orally. ROGAINE is obviously the trade name that most people know it by, but now it's a topical solution. It comes in foams, it comes in sprays, and essentially you spray it onto the problem area, which is the hairline, especially where you're losing hair is where you're going to want to apply the most of it. And you're going to want to be kind of careful to not get it on your face, not get it on areas that you don't want to regrow hair, including the beard area for women. But you will start to grow hair in those areas. It's a very interesting medication. So for people who are using it like in the shower as a foam, and that foam washes down to your face, it's important to know that you might start growing hair there. So very interesting medication. Side effects of this medication. Now this kind of goes for all hair loss medications and hair regrowth hair stimulants, as well as things like finasteride, which are more preventative. You're going to want to be on these for life. As soon as you stop using hair loss medications and hair stimulant medications, you're going to regress and you're going to start losing your hair again. So very important to know that you need to be on these for as long as you want to keep your hair. Another important thing to know about Minoxidil is when you start losing it, it is known to mess with the hair regrowth cycle. So when you start using it, you may actually experience some shedding of hair over those first few months. This is a point that scares a lot of people. They're like, I'm using this new medication and it's doing the opposite. I'm not regrowing hair, I'm actually losing hair. And that can be scary, that can be daunting. And a lot of people will stop using the medication, call it a failure, and say that they had a reaction to it. But that's not the case. You need to give the medication a long enough time to work. You need to experience an entire change of the hair cycle and let the medication take action. This can take 3 to 5 months before you start seeing the medication really start to work, some new hair follicles to sprout out, and existing hair follicles to get stronger and thicker. So, when you're using this medication for the first time, it's normal to expect some hair loss at first. This isn't going to be the case going forward. Once you start using the medication 4, 5, 6 months, you will experience new hair follicle growth. You will experience increased density of existing hair follicles. Now, I use this medication once or twice a day. I'm not religious about it, but at least every night before I go to bed after the shower, I will squirt this directly onto my most affected areas. For me, that's the receding hairline and the thinness in the front. For everyone, it might be different, but anywhere where you're starting to experience thinning or loss of hair, you're going to want to spray this directly onto the area, rub it in, and just leave it overnight. You can use it up to twice per day, sometimes more. It's a very safe medication. Because it's topical, you won't experience any of the side effects that you would have with the oral, such as erectile dysfunction or anything like that in men, it's a very safe topical medication. Just be ready for that initial side effect. A couple other side effects that are less common that you could watch out for is irritation at the area. Again, this is a topical medication, so the side effects are limited, but if you feel itchy or scratchy or red or dry, stop the medication and talk to your doctor. Now, in terms of how I use it and how I recommend you use it, again, there are multiple different types of drugs that you can buy that contain the minoxidil solution. There's different strengths of the solution. It comes in, I believe, a 3 and a 5%. ROGAINE is obviously the most common, the most historical minoxidil solution. You're free to use that one. It can be more expensive. I simply went on Amazon and I got this Just for Men 5% topical minoxidil solution. It contains the same drug. It should have the same effect, and it's extremely affordable. There's no limiting factor for you to acquire this medication. You don't need a prescription. You can get it over the counter. You can get it online. You can go to Hims. There are some prescription solutions of this that you can buy. However, you don't need them. Again, this is an area where you can save money. Use an over-the-counter solution. It should do the exact same thing. Now, if you want the fancy foam from ROGAINE, feel free to go and do that. As part of my 4-step solution, I highly recommend that you try this medication. Again, this is one that has limited side effects. It is very cheap and easy to use. It's very convenient. You just squirt it on at night before bed. And it's not oral. It's not systemic. You won't experience any of those systemic symptoms or side effects that you might have with finasteride, such as erectile dysfunction. This is a very safe medication, very easy. Definitely one that you should be adding to your hair regimen. The only factor that may affect your ability to continue to take it, or your willingness to continue to take it, is you should get ready in it and prepare for some initial shedding of those smaller, thinner hair follicles. Again, this is temporary. It will reverse. You will start to see thickening. You will start to see new hair regrowth. This is a stimulant. So definitely a medication I would suggest you use, again, with my other 3 steps, including finasteride, PRP, and red light therapy. This is a great adjunct. It works synergistically as a stimulant, especially with the red light therapy. What I'll do is I'll use this, and this is kind of the golden nugget for waiting until the end, so thank you. I use this at night. My regimen, I take my finasteride, I apply this to my affected areas, rub it in, I get in bed, and I use my red light helmet for 7 minutes. Now, they have never done clinical studies of these medications together, so when I'm telling you that I do this and that I recommend this, it is just because it has a very low risk profile and because it makes logical, intuitive sense to me as a medical professional. So what I do, I use my ROGAINE, my minoxidil, I spray it onto my affected areas, go into bed, and I use my red light therapy for 7 minutes. They're both stimulants. Now, this penetrates the hair follicles, binds those hair follicles, and through whatever mechanism causes new hair growth and causes follicle stimulation, as does the red light therapy. It causes cellular stimulation. Now, this penetrates deeply, and I believe the red lights activate the medication and increases the effect of the medication. Again, not clinically proven, makes logical sense, low risk profile, so I suggest you try it. Hope that was worth sticking around to the end of the video on minoxidil. If you have any questions, please drop them in the comments. I'd love to have a conversation about the medication, answer any of your questions, and please, if you're not already, subscribe to the channel, turn on the notification bell. We'll be doing a lot more content about men's health, about hair loss, about these medications, and I share a lot of really cool medical hacks that may not be clinically proven, but make good logical sense, such as my 4-step hair protocol, and you don't want to miss them, guys. So I do appreciate you sticking with me. I hope this was helpful. If it was, please like this video. It does mean a lot. Other men can find this. Other men will be able to find treatment for their hair loss. If you just hit the like button and if you share this video, it means a lot to me. And you'll be able to help other men as well. This is really my goal here, and I hope I was able to help you. And please let me know if I was. Talk to you soon. See you in the next video. Bye.